Gastric bypass is a surgery that helps control the amount of food you eat by shrinking the size of your stomach. After the surgery, patients feel full with less food and the food will be absorbed differently. Some patients who have lost a lot of weight and are now dealing with lots of excess skin and tissue. Dr. Kordestani is in with us today to talk about a cosmetic surgery post-gastric bypass. So I feel like this is very important because I've seen some pictures, I've seen some results, and sometimes you just need some help, right?
It's actually, well, good to see you as always.
Yes.
So yeah, you bring up actually a very interesting point. The operation or the grouping of operations that are categorized as gastric bypass have gained a lot of popularity because it really helps people to lose a tremendous amount of weight and actually become healthier. So just to give you an idea, 2017, just the numbers were finally tabulated. It's about 230,000 operations, gastric bypasses are done. And specifically the most common, which we do in Amarillo, not myself, but some of the guys actually do, is a gastric sleeve. So you do that operation and then you have a precipitous drop in the weight, and surprisingly and thankfully you actually get healthier. The diabetes resolves, the blood pressure problems resolve, and you actually become healthier. But as you pointed out, all of a sudden you're left with a lot of skin. Right.
So you sent us a picture. So let's pull that up and kind of walk us through what we're seeing.
Well, this is actually one of our patients who offered to help kind of relay the message because of the fact that one of the things we do, we talk about the experience. You start after all the weight loss, but unfortunately you end up with all this extra skin, and then you come to us, and it's not a one-shot deal. We actually work with you, get you ready for surgery, and in this case, our patient came in and she'd already been in the gym for 2 hours. I'm sorry, not 2 hours, excuse me, 2 years. And then she'd done her best. And then she came, and the pictures you can see on the left side is, you know, you'll see her before the operation. And then in her case, what we did, it's a circumferential lipectomy. That's a big word. Basically, to give you a better idea, that's a tummy tuck that goes all the way around. So it's 360 degrees. So in her case, we actually took about 20 pounds of skin off.
Wow.
And as you can kind of see with the picture, you went from one extreme to the other. And she woke up and she goes, for the first time, I feel like the outside matches the inside.
Right.
So it's one of the many operations we can offer these people, and it really helps them along in the transformation.
So let's talk about the operation. Is it very invasive?
Very much so,
yeah,
because of the fact that, again, if you can think about it, it's a tummy tuck that goes all the way around the body. But we've gotten a pretty good result on it, and the teams that we use have become very good and known around the country because it's something that we do often and we do it well.
So in your opinion, do you think everyone that has this type of surgery will need this cosmetic procedure after?
No. I mean, that's actually a great question because everybody's body's different. So there's several different procedures that are possible procedures for these types of patients. I've seen patients that have dropped the weight and their skin has bounced back and have needed nothing. So those aren't very common, but they exist.
Right.
So, and again, by the same token, there's 5, 6 different procedures. So a few people need all of those. Everybody else kind of falls in the middle. So I've seen patients that didn't need this operation, and I've seen patients that did.
Well, this is very interesting, and so if y'all are wondering about more or anything, you can give our friends at AOMS Plastics a call. Dr. Kordestani, as always, thank you for this information. It's always very interesting to learn from you. Okay.
I'm glad to be here.
Okay.